Happy Sabbath. Happy day. So my name is Bethtryl Beth, and I'm a medical doctor by profession, specializing in epidemiology, and I work for HIV/AIDS programming and also TB. So for this morning, I'm going to focus on HIV. I know for a long time HIV used to be a pandemic, was talked about a lot, but in the recent times, I think we don't talk about it enough, and we can see the effects in terms of the statistics. So I'm going to start with the statistics to just give us the context. So in terms of the global picture, we have an estimate of about 40 million people living with HIV worldwide, and each day in 2023, approximately 685 children became infected with HIV. And approximately 250 died from AIDS. So we can see the mortality rate is still quite high. And in terms of our environment, that is Kenya, we have about 1.6 million people living with HIV/AIDS, which means our prevalence rate or our incidence is 6%. And out of this, we have 10 counties, which includes Nairobi County as one of the heavy burden counties. So we contribute more than half, that is 57%. And the vulnerable groups include AGYW. Who are AGYW? These are adolescent girls and young women, and this age group is between 15 and 24. So they are among the group that reports a very high rate of new HIV infection. That, I believe, is the Gen Z. So my focus today is going to be on prevention, and now we talk more on combination prevention. So in terms of combination prevention, I know what we have focused on in the past have included abstinence, condom use, and most recently we have VMMC, that's voluntary medical male circumcision, which has been shown to significantly reduce the chance of HIV infection. Then we have PMTCT, that's prevention of mother to child. And so this has been through adequate treatment and keeping pregnant mothers on treatment to suppress their viral load has shown to reduce significantly HIV transmission rate to the unborn child. And also once the child is born, we have prophylaxis that is given to the child until cessation of breastfeeding, because the risk of transmission is there perinatally, during breastfeeding, and even during the childbirth. Then we have PEP and PrEP, and Kenya actually was the second country in Africa to effect the use of PrEP. So PrEP is the pre-exposure prophylaxis. This means it's an antiretroviral drug that is used before exposure, and soon we are going to look at the groups that are eligible for PrEP use to prevent HIV. So we have PEP and PrEP. We'll be able to look at the difference between PEP and PrEP, and we'll also look at ART as prevention. So maybe just to ask the congregation, how many people have ever heard about U is equals to U? Just by show of hands, especially if you don't work in HIV programming. Nani amesikia U is equals to U? Just raise your hand. I can see one from the other side. Do you work for HIV programs? Are you a healthcare worker? Okay, if you are not a healthcare worker, you know U is equals to U. So it seems we have not heard about it. U is equals to U basically means undetectable is equals to untransmittable. What does this mean? If someone has HIV and they're on medication and their viral load is what we call undetectable, that is, your viral load is below 200 copies, it means you cannot transmit HIV to your sexual partner. So that is why we have discordant couples. I'm sure you have heard about discordant couples, where one is HIV negative and the other one is HIV positive. As long as the HIV positive partner is on their medication and taking their medication well, and their viral load remains unsuppressed, they are unable to transmit to their partner. And we can see in terms of statistics, most of the couples, especially who are the younger generation, the millennials and it's called Gen X, they still have a bit of stigma and they don't believe that U is equals to U works. But the Gen Z, we see at our clinics, we see a lot of discordant couples, and they live well and they give birth to HIV negative babies. And this has also helped us in terms of stigma reduction among our population living with HIV/AIDS. So maybe to just touch a bit on the differences between PEP and PrEP. So PrEP is pre-exposure, which means you take it before you are exposed. Say, for example, if you have a discordant couple and the partner who's positive is not virally suppressed, which means there's a risk of transmission, we will put the negative partner on PrEP. So it's a medication where you take daily. It's like ARV, but it's only a combination of 2 drugs, unlike the ARV, which is 3. So they'll take this daily and they still live with their HIV positive partner to prevent transmission. Whereas PEP is post-exposure prophylaxis. So this is an incident where you have accidental exposure. It could be a health worker who during your service delivery, maybe you prick yourself when attending to a patient. Then you take it for 28 days every day just to prevent transmission. We also give it to people who unfortunately get raped. And if you know of such a person, then they need to be at the health facility within 72 hours for the PEP to be effective, yeah? So in terms of key populations are people who are most at risk of contracting HIV. And maybe just to briefly go through them, of course, we have the sex workers, we have the transgender, MSM, men who have sex with men, people who inject drugs, and people in prisons and other closed settings. So that we get how our AGYW are at risk, they have also been included in other priority populations. That's the others are fisher folk, clients of these sex workers, and our adolescent girls and young women. So I know within here, some of us are parents, and we have children, or rather girls, who are between this age of 15 to 24. They are recording very, very high rates of HIV transmission. So I think it's good to teach them these combination preventions that we teach. I know I grew up in an Adventist church, and I don't remember getting any of these things being mentioned in church. You know, in Adventist, it's like these things, they don't apply to us. Us, we only teach abstinence. India, we don't know about these other ones because we are Adventists. True or not true? Okay. So, in terms of the PrEP, when we initiate clients on PrEP, it's very good to also look at the eligibility criteria. Before we initiate you, we have to ensure that you are HIV negative, and we'll do a repeat test after the first month and 3 monthly afterwards to ensure there's no transmission. And especially because sometimes clients may not be taking their drugs faithfully. And also we need to monitor some of your blood functions to ensure the PrEP is working effectively. So in terms of the HIV pandemic, I think we need to continue talking about it because the numbers have been fluctuating. Kenya had made significant strides in terms of controlling of the pandemic, but when we stopped talking about it, I know the older generation who witnessed the real pandemic, they're quite aware, but our younger people, the Gen Z, they are not very cognizant of it. So my encouragement is that let us talk to these young people, let us teach them, and then let us apply this even as I know we are SDAs, even as we teach these other prevention methods, let us not forget to mention these others. Thank you very much. May we have a blessed Sabbath.